For the most part, the skin manifestations seem to self-resolve. What I think is most important to recognize are the purpuric lesions that are branching, especially if it's bilateral symmetric gangrene. Generally, as I said, those are in patients who are already hospitalized. But as hospitals become more crowded and overwhelmed, and some patients I know are wary of going to a hospital or a clinic, and if they are at home, they really need to be aware of these bruise-like lesions, especially if it's affecting the fingers or toes. And that's why I think the COVID toe phenomenon, the perniotic lesions, can be confusing, because those actually are not truly the same thing as bruise like necrotic type of lesions that can affect the fingers or toes. So there's a difference that I think most dermatologists can recognize, but other people may confuse it just without thinking about it too much. The importance of that is because the acroperniotic lesions are considered by most to be a late manifestation of COVID-19. And some experts consider it not even maybe to be related to COVID-19, but just a coincidental increase in idiopathic or autoimmune perniosis. In contrast, the purpuric lesions are a warning sign that you could be having clotting in other areas of your body, including your lungs or other body organs, and that can be a really bad sign for the patient. So a patient who truly has bruise-like lesions that are branching should, if they're not already in the hospital, be in touch with their doctor right away and be evaluated. That patient, even if they're really kind of worried about going to a hospital or clinic, there's telemedicine in a lot of areas, so they can at least sort of show the doctor video or maybe email pictures through electronic medical records and be evaluated.